everyone. So today we're going to be treating a brand new topic, and this topic is basically affecting the musculoskeletal system. So it's a musculoskeletal disorder, a genetic musculoskeletal disorder, and it is known as skeletal dysplasia. So we've all heard about this condition called dwarfism. So this skeletal dysplasia covers this particular condition known as dwarfism and other groups of genetic disorders that affect the development, growth, and structures of the bones and the cartilage. So these disorders, they cause abnormal skeletal growth, and this leads to short stature, bone deformities, and joint problems. So skeletal dysplasia, they vary widely in the severity. So some types may result in wild growth abnormalities, while others can lead to severe physical disabilities or life-threatening complications. So the condition is usually diagnosed in infancy or early childhood, although some forms can be detected before birth through ultrasound or genetic testing. So you could know if your child has this deformity before even giving birth to this child. So there are over 450 different types of this skeletal dysplasia, with some of the most common including achondroplasia, which is the most common cause of disproportionate short stature. So the most common cause of dwarfism. Then we have osteogenesis imperfecta, which is a condition characterized by having brittle bones. So your bones are very fragile and it can easily break. Then thanatophoric dysplasia, which is a severe and often fatal skeletal disorder. Then we also have hypochondroplasia, which is a mild form of dwarfism. It's not a complete dwarfism, it's just a mild form. Then we have multiple epiphyseal dysplasia, which is a condition that affects the development of the joints. So when we're looking at the background of this skeletal dysplasia, it is majorly caused by genetic mutations that affect the bone and the cartilage development. So these mutations, they can be inherited from parents or occur spontaneously. So maybe a new mutation that is not passed from the parents. So it could be that in some cases you could see two normal two adults that don't have, for example, that don't have dwarfism, and then all of a sudden they give birth to a child that have dwarfism. This is an example of spontaneous occurrence where there's a new mutation that is not passed from the parents. So the genetic basis, we have different genetic bases. So the first, autosomal dominant inheritance. So here affected individuals inherit the faulty gene from one parent. That is, we see this in achondroplasia, which is caused by mutation in the fibroblast growth factor receptor 3 gene. So achondroplasia usually comes from inheritance, like it's usually inherited from one parent. Then autosomal recessive inheritance, where we have both parents who must carry the gene mutation for the child to be affected. So in this usually occurs in cases like dystrophic dysplasia. Then we have X-linked inheritance, where the faulty gene is located on the X chromosome. So we can see this in some forms of this brittle bone condition known as osteogenesis imperfecta. Then there's another genetic base known as de novo mutations. So like I said, these are new mutations that occur randomly and are not inherited from either parents, and it's common in achondroplasia. Like I said before, you could have two parents that don't have dwarfism, and then they just give it to a child that has dwarfism. So achondroplasia has like different patterns where it can come from. You could get it from one parent. Like there's this family I usually watch on TikTok where the father has achondroplasia, and then the mom, she doesn't have it. So the child ended up having this achondroplasia. So this is an example of autosomal dominant inheritance, where one parent transfers this gene, and then achondroplasia too could also be transferred from de novo mutations without anybody having it. So this is basically the breakdown of like how this genetic disorder occurs. Then looking at the discovery and research, so the study of skeletal dysplasia has advanced majorly due to genetic testing and molecular research. So the first major discovery was there's this particular gene known as fibroblast growth factor receptor 3 gene, and is a gene mutation that is particularly responsible for achondroplasia. Then there are also prenatal genetic testings that can now detect many skeletal dysplasias before the birth of the child, so allowing early diagnosis and management planning. So most of the time, some parents even know they get to know that their child has achondroplasia even before birth, and they get to plan ways of how to make life more comfortable for them, how to manage the whole things, and they study about all this. They study about the condition and how best to make the baby more comfortable and all that. So through this research and genetic testing, that it has made that possible basically. So when we're looking at the prevalence, so this skeletal dysplasia affects approximately 1 in 5,000 births worldwide, and some forms such as achondroplasia is usually more common than the others, like thanatophoric dysplasia, which is extremely rare. So achondroplasia is usually the most common form of this skeletal dysplasia. So looking at the signs and symptoms, the signs and symptoms of this skeletal dysplasia depend on the specific type of the skeletal dysplasia, but they usually include like general skeletal features like short stature, you see in dwarfism, and it can be proportionate, so it can affect all body parts. So all your body parts will be small, or it can be disproportionate, that is, some body parts are more affected than others. So you could see some people having longer hands than legs, or longer legs than hands, so it could be disproportionate or it could be proportionate. Then bowed legs or knocked knees, which is the abnormal alignment of the lower limbs, so it's also part of the general skeletal features. Then shortened arms and legs, so this is common in conditions such as achondroplasia. Then joint stiffness or excessive joint flexibility, leading to mobility issues. Then we have spinal deformities, like you see it in scoliosis, kyphosis or lordosis. So these are the symptoms and signs of like the general skeletal features we see in these conditions. Then when we're looking at craniofacial abnormalities, so there will be presence of large head with a prominent forehead, known as like frontal bossing. That's what they call this condition. And then sometimes you see a flattened mid-face with a small nose, which is usually common in achondroplasia. Then you see cleft palate too. In certain skeletal dysplasias, you also see cleft palate. Then when we're looking at neurological and respiratory symptoms, so there will be the presence of spinal cord compression. So this will lead to weakness or numbness in the limbs. And then there's something also known as hydrocephalus, which is excessive accumulation of fluid in the brain. It can be present too. And there could also be presence of breathing difficulties, particularly in severe cases where the rib cage is small. Then in cases there could be something known as fracture susceptibility, that is like in osteogenesis imperfecta, where the patient has like presence of brittle bones that can break very easily. So the bones, they break easily due to a defect in the collagen formation. So these are just the signs and symptoms that can be seen in people that have this defect. So the clinical presentation, so for prenatal and neonatal presentations, severe forms of skeletal dysplasia such as thanatophoric dysplasia can be detected before birth using an ultrasound. So they can detect this condition using ultrasound. And affected newborns, they may have severely shortened limbs, abnormal rib cage, and breathing problems. So this could be the telltale signs for the affected newborns after their birth. Then childhood presentations, because we just covered presentations for the neonatals and the prenatals. So when we're looking at childhood clinical presentations, there could be signs like delayed walking or difficulty in movement due to joint deformities. Then having frequent fractures, like in conditions like osteogenesis imperfecta. Then development of spinal deformities too is also part of the childhood presentations. Then when we look at the adult presentations, so there will be milder skeletal dysplasias, which may go undiagnosed until adulthood, when the patient experiences joint pain, back pain, or they experience early onset of arthritis. So this is basically about the clinical presentations. So I broke it down into like how we would see it in prenatals, neonatals, childhood and adult presentations. Then when we're looking at the etiology and the cause of this skeletal dysplasia, so skeletal dysplasia occurs due to genetic mutations, like I said before, that disrupt the normal bone growth. And some well-known mutations, like I said, the FGFR3 gene mutation, which causes achondroplasia and thanatophoric dysplasia. Then we also have other mutations too, like there's this mutation known as COL1A1 and COL1A2 gene mutations, and they cause osteogenesis, and they are the major cause of osteogenesis imperfecta because they affect the collagen production. So these are just the common causes of this skeletal dysplasia. Then risk factors like family history. Like I said, it's a genetic disorder, so family history is the number one risk factor. Then advanced paternal age increases the risk of spontaneous genetic mutations. So advanced paternal age, basically when an older male has a child, so having advanced paternal age will increase the risk of having these spontaneous genetic mutations. Then parental consanguinity, which is blood relation between parents, so it increases the risk of recessive disorders too. Then when we are looking at the anatomy and physiology, so this skeletal dysplasia, it affects the growth and structure of bones and bone growth process. Basically, normal bones, they grow through endochondral ossification, where the cartilage is usually replaced or gradually replaced by the bone. Then cartilage development, where some skeletal dysplasias, they disrupt chondrocyte formation, leading to abnormal bone formation. So when we're looking at the pathophysiology, the primary disease mechanisms include having defective chondrocyte proliferation, which will lead to early growth plate closure, then having abnormal collagen synthesis, which will cause weak bones, then impaired osteoblast and osteoclast function, leading to abnormal bone density. So this is just the pathophysiology of this condition. Then for the diagnosis, so like I explained before, for prenatal diagnosis, ultrasound, it can detect shortened limbs, abnormal skull shape, or rib abnormalities before the child is born. Then genetic testing like amniocentesis, or chorionic villus sampling, they can confirm mutations. And then for postnatal diagnosis, physical examination reveals characteristic skeletal abnormalities, so just physically examining the newborn or the baby. And then we also have x-ray imaging, so this shows abnormal bone shapes and growth patterns. Then genetic testing too, it identifies the specific gene mutations. Then bone density scans, for example DEXA scans, they can assess the bone strength in conditions like osteogenesis imperfecta. So this scan can assess the strength of the bone. Then looking at differential diagnosis, so like I said before, differential diagnosis is basically conditions that mirror or mimic the same signs as the condition being treated. Like for example, rickets. Now rickets is caused by vitamin D deficiency, but it usually presents with similar bone deformities like is seen in skeletal dysplasia. Then we have hypothyroidism, which can cause growth retardation and skeletal abnormalities. Then there's also another condition known as mucopolysaccharidosis, which is a group of disorders that cause joint stiffness and skeletal deformities. So these are just other conditions that can mimic the same signs that are seen in skeletal dysplasia. Then for management or the approach considerations, medical treatments like using biphosphonates to improve the bone density in cases of osteogenesis imperfecta. Then growth hormone therapy in selected cases. Then when it comes to surgical treatment, so there's a surgery known as limb lengthening surgery, which is used in selected cases of dwarfism. Then for scoliosis, spinal surgery can be done in severe cases to correct the deformed spinal cord. Then supportive care that can be given like physical therapy, physiotherapy to improve the mobility of the patient. Then assisted devices like braces or wheelchairs, they are very useful too. So looking at the prognosis of this skeletal deformity, so mild forms, they allow for a normal lifespan with some mobility challenges, but when we're looking at moderate forms, they can cause lifelong disability, but they are usually not life-threatening. And in severe cases such as thanatophoric dysplasia, it can often be fatal at birth. So this is basically a breakdown of these genetic disorders known as skeletal dysplasia. Thank you.